Hello guys, hello my subscriber. Today 28th of March. I'm United States, California. We still follow instruction of government stay at home order. Number of coronavirus cases increase. For today it's 111,000 cases in United States positive of coronavirus and around 1,600 plus deaths in United States. Exactly compare with Italy, where today really they got 10,000 of death cases. United States is much better. What I want to tell today, what I want to talk today, I want to talk today about health care workers who stay on front line, who is face-to-face communicate with coronavirus patient. And like in New York, doctor, nurses, general health, they say now it's like really medical, they stay in medical war zone. It's more dangerous than something else. I want to show my big respect for people who is in this very difficult time stay on front line and try to help, try to do best for people who are suffering from coronavirus or who came with another health problem. I am doctor, I know that more difficult it's casualty. And today I want to introduce Sean, who is working in casualty, one of biggest Los Angeles hospital, and who explained for us a little bit about this very difficult job, especially now. I know like Sean, he's working now 6 days a week, totally does not have too much rest, and I respect his very hard job. Okay, Sean, how are you today?
I'm good. I'm getting my day's rest.
Yes, okay. I'm very happy to see you today in very good health, still to be optimistic. And why I invited today for this conversation, because too many my friends from Zimbabwe, hi guys, everyone, all my team, and for example, from Ongucheni Hospital, but what it's mean team, start from general hands, nurse, doctors, psychologist, my secretary, Opa Helen High, my driver, Mr. Kuba, we are a team. And if we are working together, we can see result of treatment of our patient. Just the same, shown for you. Everyone asks how it's difficult now for you to do your job at casualty, especially if you're face-to-face working with coronavirus positive patient. I know my doctor now, especially from government hospital, they're on strike because they don't have in Zimbabwe enough protective clothes. Can you explain for me your duty, for example, when you are coming, what are you doing? At least, especially for, do you have defense clothes, ABCD? Do you have special stuff for protection? Can you explain for us?
Yeah, well, I mean, it's certainly been a challenge. We've had to create extra treatment areas at our hospital, at the emergency room. Generally, we see about 350 patients a day. And now we have to begin treating each of those patients as if they could indeed have the coronavirus. We've set up screening tents outside. We've set up a treatment tent outside as well, where we can treat probably about 10 to 15 extra people at a time. Get them seen quicker and tested, and then hopefully on their way home can minimize the time of infection, and minimize our time of exposure. As far as equipment, it actually hasn't hit us too hard yet, but we have to continue bracing ourselves as this virus looks like it's hitting Los Angeles harder, and we do expect more cases to be had. Just got word from our hospital that we actually do right now have enough protective equipment. However, we don't know how long this is going to go for. We have to brace ourselves and prepare for the worst. Unfortunately, cases like Italy and New York, we don't know if that is the normal or if that is an outlier. So we have to treat it as the worst case scenario, especially with as dense a population as Los Angeles and Los Angeles County has, and California as a whole with 40 million people. For now, looks like most people for the last couple weeks have been staying home. Very good, following recommendations of the CDC. Wash your hands, don't touch your face.
Social isolation,
social
distance.
isolation. But yeah, I mean, everyone's doing a great job. Our ER itself has been well prepared. We normally just have our simple mask for now. We have
What about protective clothes?
equipment.
Protective clothes?
We have gowns that we can wear. We have booties on our feet that we can wear. And right now we actually have enough of that, and it's been quite good. Bit of a rough transition at first, but we're getting used to it. It's been a few weeks now, and I think we're becoming more prepared as we begin to learn more about this disease and prepare for more testing and more people to get sick, and hopefully just reduce the time, sort of flatten the curve, as people have been saying. It's important to remember that the amount of cases isn't necessarily the end-all be-all. When people talk about the curve, they talk about two different curves. They talk about one curve like this, it's more flat. This curve here is our capacity for the hospital. What's happened in Italy is a very steep curve like this. When this is their capacity for the hospital, the curve has exceeded that. And that's what we really, really want to avoid. So we do ask that if you are sick and you even may think that you have the coronavirus, make sure you contact the public health department. Try to get tested. Right now we don't have enough tests, but they're making way, and tests are improving. They've gone from a 6-day turnaround to about a 3-day turnaround. So you don't have to wait almost a week to get your results. You can wait just 72 hours.
72 hours, yeah.
72 hours is the latest test that we have, and it looks like tests are becoming created more and more quickly. So that's good news. We're getting more and more good news every day. Try and parse it with the bad, and really need to take a step back and look at the reality of the situation. We have to keep our fingers crossed here and just follow the instructions of the leadership.
Yeah. Are you afraid? Everyone asked me, really, I was forensic psychiatrist. They say to me, doctor, you were brave, go to see criminal. But are you afraid to have contact with coronavirus patient, positive patient?
I believe the more we begin to learn every day about this, it certainly lessens our fears. Of course, when you see what's happening in Italy and you see what's happening in New York, and now Spain is increasing in their cases a lot, you really begin to cross your fingers and really take more precautions, which is good. And that should be a good indication for everyone that these guidelines are working, the social distancing, people staying home, and treating it as if it's like the flu, which is what we think it is as a new strain of the coronavirus, this COVID-19.
At least we can see how it's going on. We are waiting for vaccine and see how it's going on. At least for my friends from Zimbabwe, you must understand, especially for my friends who is working in casualty. Like Sean explained, when he's coming every morning, first before start his duty, you check up your temperature, correct? When he has finished his duty, just the same, he check up his temperature, and exactly he must explain for manager how is he feeling after finished his duty. If any change, for example, suddenly temperature, suddenly started to have dry cough or fatigue, exactly, you must test for coronavirus, and in this situation you are feeling protection, at least you are protective, and you are not maybe afraid to get some serious problem. I know what I like in the United States. You have too many donors, you have too many supportive people. All restaurant, all bakery, all coffee shop closed. But you have too many donors who are coming to casualty, who are coming to hospitals, and try to bring food for all health worker, for healthcare workers, Is it correct, Sean?
Yeah, we've actually gotten lots of good local support with local businesses and restaurants asking what we need, bringing food.
At least it's breakfast, lunch,
almost every day. They're
every day,
actually donating food for the workers here, and they recognize that we are on the front line, and they recognize that sick people are going to still come to the emergency room for whatever reason. And so it is really appreciated. Our hospital's still taking donations as well. Like of masks, whether homemade or just extra mask, gloves, other PPE that we could use. Yeah, it's been a really good experience to push us forward and help our day sort of become a little easier and sort of get by through these rough days.
Yeah, at least we mustn't thank you very much, these people. Too many, you see, good people who try to help, who can understand situation, who respect really people who stay on front line. And just the same, I got story from Sean that too many homeless now. Is it correct?
Yeah, we're seeing we're still our homeless population. They do come in every day, and we're still trying to work out places for them to go, and we really do our best. Unfortunately, for sometimes these people, they just want a place to rest and
Yeah.
some food to eat, and we're not allowing any visitors at all at our hospital. So as soon as you're discharged, you actually do need to leave, where sometimes they'll be able to rest in the lobby for a little bit, or at least in the room that they're in for a little bit. But now times are a bit challenging. These people still have nowhere to go, but they're told that they need to be kept inside. So that's been a big challenge as well.
Because some of my friends from Zimbabwe, they said, America exactly a very expensive country. They said, if something happen, I don't have medical aid, and coming to casualty, member of staff, healthcare member, they are going to help me or not. And for example, your explanation shown about homeless, they're coming, you are doing really free service for homeless people.
Yeah, absolutely. There's no one that's going to be left in the
You
streets
can't
here in the
refuse.
United
You can't
States.
refuse to say, for example, you don't have medical aid. I don't want to do. For example, I don't want to
Yeah,
help
of
you.
course.
You are going, especially in this
Of
difficult
course,
time.
anyone who comes to an emergency room anywhere in the United States, they get seen for free, they get fed, they get a place to sleep, and they make sure that they get a ride to a safe place where they can go home. At least in California, the laws have become improved for the homeless population to try and handle the crisis here. And so that's how it affects the emergency rooms here. Not sure as far as the rest of the
Yeah,
United States,
yeah.
but they definitely do get care in RER.
Okay, Sean, you are a very brave man. I respect you too much. Your advice for people, how to stay, to be safe in this very
course.
difficult situation.
Of course, I mean, in a situation like this, in general, you should have at least 2 weeks prepared of food and supplies. Wash your hands, keep distance from people. Try and stay indoors as much as possible and just lessen the contact with the outside world, lessen the exposure that you could have with other people. Of course, if you have any questions, always contact medical professionals, contact the public health department. If you can, try and get a test. Being tested just to know and limit your exposure is probably best. Of course, even though this does affect the older population, it can affect kids, and fortunately enough, it doesn't affect kids to the same that it affects the older population, but do recognize that they could still be carriers for the virus, and that they could transmit it to the grandparents, great-grandparents, and the parents, and everything else that they come in contact with and touch, yes.
Okay, Sean, thank you very much. As a psychiatrist, I want to add, stay brave, not any panic, not any anxiety, not any depression. At least you know we have people like Sean, ordinary American people who stay on front line, who anytime if you're coming to casualty can help you and never refuse. Doesn't matter you have or you don't have medical aid. Okay, guys, keep well, look after yourself. Thank you very much, Sean.
Of course.
Stay safe, stay healthy. Okay, guys,
Bye.
bye everyone.